That health tip your grandmother swore by? It might be completely wrong. Nurses see the consequences of medical myths every single day: delayed treatments, wasted money, and unnecessary risks. Let's separate fact from fiction. Myth number 1. Feed a cold, starve a fever. This old saying has survived for centuries, but nurses wish it would retire already. The truth is, your body needs adequate nutrition and hydration whether you're battling a cold, flu, or fever. When you're sick, your immune system is working overtime, which actually increases your caloric needs. Starving yourself during a fever doesn't help your body fight infection. It weakens it. Your immune response requires energy and nutrients to produce antibodies, white blood cells, and the proteins needed to combat illness. Dehydration from fever makes things worse, not better. What nurses actually recommend: eat light, nutritious foods if you can tolerate them, and focus heavily on staying hydrated with water, herbal tea, or broth. If you don't have an appetite, don't force large meals, but definitely don't intentionally starve yourself. Myth number 2. You only need to worry about blood pressure if you feel symptoms. This dangerous myth sends nurses into frustrated overdrive. High blood pressure is called the silent killer for a very good reason. Most people with hypertension feel absolutely nothing until serious damage has already occurred. You can have dangerously elevated blood pressure while feeling perfectly fine, exercising normally, and going about your daily life. Meanwhile, that silent force is quietly damaging your blood vessels, heart, kidneys, and brain. By the time symptoms appear, chest pain, severe headaches, vision problems, you're often facing a medical emergency. The reality check: millions of people have high blood pressure without knowing it. Regular screening is essential, especially as you age, or if you have risk factors like family history, obesity, or diabetes. Your blood pressure doesn't care how good you feel. Myth number 3. Cracking your knuckles causes arthritis. Nurses hear this one constantly from worried patients who've been cracking their knuckles for decades. Here's the relief: there's no scientific evidence linking knuckle cracking to arthritis. That popping sound comes from gas bubbles bursting in the synovial fluid that lubricates your joints. Multiple studies have examined habitual knuckle crackers and found no increased arthritis rates compared to non-crackers. One researcher even cracked the knuckles on just one hand for 60 years and found no difference between his hands. That said, excessive or forceful joint cracking can cause ligament damage or reduce grip strength over time. So while it won't give you arthritis, moderation is still wise. But if you're a casual knuckle cracker, you can relax. Your joints are fine. Myth number 4. Antibiotics can treat colds and flu. This myth frustrates nurses more than almost any other because it contributes to one of medicine's biggest threats: antibiotic resistance. Let's be crystal clear. Antibiotics do absolutely nothing for viral infections like colds and flu. Nothing. Zero. Zilch. Antibiotics kill bacteria. Colds and flu are caused by viruses, which are completely different organisms that don't respond to antibiotics at all. Taking antibiotics for a virus is like using a hammer to fix your computer. Wrong tool, won't work, might cause damage. When people take unnecessary antibiotics, they kill off beneficial bacteria in their body and contribute to creating antibiotic-resistant superbugs that endanger everyone. Nurses see the consequences daily: infections that no longer respond to standard treatments because bacteria have evolved resistance. The truth: viral infections need rest, fluids, and time. Save antibiotics for actual bacterial infections diagnosed by a healthcare provider. Myth number 5. You lose most of your body heat through your head. Bundle up, or you'll lose all your heat through your head. Nurses roll their eyes at this pervasive myth, which likely originated from flawed military research decades ago. The reality is, your head accounts for about 7 to 10% of your body's surface area and loses roughly that proportion of heat. Nothing special. You'll lose heat through whatever body part is exposed to cold. If you're wearing a winter coat but no hat, yes, you'll lose relatively more heat through your uncovered head. But that's true of any exposed skin. Your head isn't some magical heat radiating device. What matters? Dress appropriately for the weather by covering exposed skin, including your head, hands, and neck. But your head isn't inherently more important for heat retention than other body parts. Myth number 6. Sugar makes kids hyperactive. Parents are convinced of this one, but nurses and nutritionists know the science tells a different story. Numerous controlled studies have found no direct causal link between sugar consumption and hyperactivity in children. Even children with ADHD don't show increased hyperactivity after eating sugar when studied in controlled conditions. So why does this myth persist? Context matters enormously. Kids typically consume sugary treats at parties, celebrations, and exciting events where they're naturally more energized and less supervised. The environment creates the hyperactivity, not the sugar itself. That said, sugar isn't health food. Excessive consumption contributes to obesity, dental problems, and poor nutrition. Limit it for legitimate health reasons, but you can stop blaming birthday cake for your child's wild behavior. The excitement of the party is the real culprit. Myth number 7. You need to drink 8 glasses of water daily. Nurses appreciate the hydration enthusiasm, but this 8 glasses a day rule is overly simplistic and not based on individual needs. Hydration requirements vary dramatically based on your size, activity level, climate, diet, and overall health. Someone working construction in summer heat needs far more water than someone with a desk job in air conditioning. Your body gets fluid from foods too. Fruits, vegetables, soups, and other beverages all count. Plus, factors like pregnancy, breastfeeding, or illness increase fluid needs. The better approach: drink when you're thirsty and pay attention to your urine color. Pale yellow indicates good hydration. Dark yellow suggests you need more fluids. Your body has sophisticated thirst mechanisms. Trust them. Forcing yourself to drink 8 glasses when you're not thirsty isn't necessary and can occasionally even be harmful. Myth number 8. Natural or herbal means safe. This myth drives nurses particularly crazy because natural has become synonymous with safe in many people's minds, which is dangerously false. Arsenic is natural. Poison ivy is natural. Deadly nightshade is natural. Natural doesn't automatically mean safe, effective, or appropriate for your situation. Herbal supplements can interact with prescription medications, cause allergic reactions, or contain contaminants. Unlike FDA-regulated medications, many supplements aren't rigorously tested for safety or efficacy. What's on the label may not match what's in the bottle. Critical reality: always tell your healthcare providers about every supplement, herb, or natural remedy you're taking. Some can interfere with anesthesia, blood thinners, blood pressure medications, and other treatments. Nurses need complete information to keep you safe. Myth number 9. You should apply butter or ice to burns. This old folk remedy makes nurses cringe because it actually makes burns worse. Butter traps heat against the skin, increasing tissue damage and infection risk. Ice causes further injury by restricting blood flow and potentially causing frostbite on already damaged skin. The correct immediate treatment for minor burns: run cool, not cold. Water over the burn for 10 to 20 minutes to dissipate heat and reduce damage. Then cover loosely with a clean, dry cloth. For serious burns, seek immediate medical attention. Never apply butter, oils, ice, egg whites, toothpaste, or any other home remedy to burns. These folk treatments delay proper care and can introduce infection. Modern wound care exists for good reasons. Use it. Myth number 10. Reading in dim light damages your eyes. Nurses frequently reassure parents that their kids won't ruin their vision by reading under the covers with a flashlight. While reading in poor lighting can cause eye strain, fatigue, and headaches, it doesn't cause permanent damage to your eyes or vision. Your eyes are muscles, and like any muscles, they can get tired from excessive work. Dim lighting forces your eyes to work harder, leading to temporary discomfort. But this is completely reversible with rest. No lasting harm occurs. That said, proper lighting makes reading more comfortable and reduces strain. Eye fatigue isn't fun, even if it's temporary. Use adequate lighting for your comfort, but don't panic if conditions aren't perfect. Your vision will be fine. These myths persist because they're simple, memorable, and often passed down through trusted sources like family members. But nurses see the real-world consequences when outdated advice meets modern medicine. They're on the front lines, correcting misinformation while trying to provide evidence-based care. The best approach to health information is healthy skepticism. Question viral social media posts. Verify medical advice with qualified professionals. Recognize that just because something was believed for generations doesn't make it true. Medicine advances because we challenge old assumptions with new evidence. Your nurses have seen it all, and they're telling you, it's time to retire these myths for good. Your health and their sanity will be better for it. What medical myths have you heard that drive you crazy? Share them in the comments below. And if this article helped you separate fact from fiction, subscribe for more evidence-based health information that cuts through the noise.